I'm so happy that you all have zoomed in or whatever this platform is, StreamYarded in to hear about our curriculum. I'm happy to tell you a little about it. If you've looked on the website, you've noted that it's a structured, integrated curriculum. And the first two basic science years are really fully integrated, much like many medical schools. But there's a lot of differences, as Dr. Amati has already sort of alluded to. And we believe that by some of the changes we've implemented, we have created a situation that is extremely well suited for training you to be a medical practitioner in the 21st century and to be effective lifelong learners. And so you might want to ask, how do we do that? And this slide sort of shows you what I think are the four distinguishing features. The first thing that we do is we really strive to maximize active learning modalities throughout our curriculum. The second thing that we do is we really do that through a primary structure of peer-taught, faculty-facilitated small group learning. We strive to link everything that you learn in the first 2 years to clinical situations and real patient problems. And so by doing so, we are providing you the proper context in which you are learning these facts. And then the last thing that we really think we're doing is we are getting you to begin to learn like practicing physicians have to learn. And I'll talk a little bit more about each of these things briefly. Elliot, next slide. So this picture is sort of what Dr. Amati was talking about. This is a scene that is very, very characteristic and representative of most medical schools around the United States, around the country, even around the world. And here you have a lecture hall with a smart person in front of a whole bunch of younger, smarter people in the audience. The person lecturing, even if he or she is very, very dynamic, after you do this for hours on end, you can see these two gentlemen here are doing what Ramin was talking about, learning to sleep sitting up or with their eyes opened or closed. But nonetheless, you can see that this kind of learning isn't very active. It's a very much of a passive type of process where the guy in front of the lecture hall is trying to transmit information to people sitting in the chairs. And for years, that's the way medical schools did things. But as Dr. Amati mentioned, that is really not the best way to try to teach people. And educational theory and educational actually studies have shown that the best way people learn is to be actively engaged with the material. And so the other thing that I wanted to sort of mention from this slide is that you can imagine if you are one of the 250 people in this room, how well do you think the lecturer is really understanding what you are understanding about what he's saying? And so with those two things in mind, next slide, Elliot, we do things quite a bit differently. Here, we do things in small groups that are really peer taught, but faculty facilitated. And so there is some of the small group where the teacher is the focus of the attention, like in the lecture, but it's on a much smaller scale. And so as Louisa is teaching here on the left-hand slide, the students are engaged in listening to her. But as you can see on the right-hand slide, the focus in this particular picture is on the students. And Ilshot, the teacher standing there in the blue shirt, is really not the focus of what's going on. The students themselves are working out things. And through this active learning, this is how we really engage people. Now, as Dr. Ahmadi also mentioned, in previous and traditional medical schools, if you go into the lecture hall and you sort of fall asleep, there's not a big deal. It's no big shakes. You go off and learn it on your own. Well, obviously, in a situation like this, no one is sleeping. Everyone is engaged and everybody is part of the process. Um, Elliot, next slide. The other thing about uh, basic science years in medical school is that most medical school students have told people that it's kind of like being in a very, very long, dark tunnel. And through that long, dark tunnel, you are learning all these facts and concepts, but you are really not understanding why you're learning those facts and concepts. And Elliot, go ahead and click. There's this patient that's sort of at the end, at the light at the end of the tunnel, and you're trying to get through this long, dark tunnel to get to the patient to figure out why it is that you're learning all these things. And you'll have teachers tell you to remember this next time you see a patient with such and so forth, because you'll need to know that. Well, again, our curriculum doesn't really do it that way. Next slide. In all of the small groups, what you have learned in your study is immediately applied to clinical problems, clinical cases, and patient scenarios. And so, as you are working with your colleagues in the small groups, what you will be doing in those small groups is really answering questions using the information that you learned to answer clinical problems. And so, the concepts and the facts and all of the things that you are memorizing are now done understanding why they're important and how you're going to use them in the future when you're a physician. And the teachers that are involved, as I mentioned before, are working with only a small number of you. And so they will get to know you very well. They will get to know who's understanding things and who's still struggling, or who's really good at this concept and not so good at that concept. And they can help you in a way that's very tailored to your own needs. The other thing that's really unique about our program is that all of our teachers that are teaching are themselves MDs. They have all taken care of patients, which is often quite a bit different from other medical schools in basic science training, because we don't have a lot of PhD teachers that only know their subject. Some of these people are also PhDs, but they are MDs as well. And so they have taken care of patients and they can answer questions from the clinical standpoint of having taken care of a patient. Next. Now, what also happens in our, as I mentioned, our faculty members are all MDs and they are really there dedicated. So Elliot, you can click. What you will be doing initially and for each of your small group sessions is that you will be given through Canvas references, you'll be given resources, and you'll be given learning objectives that you will go on your own or with a study group to learn the material. That's the night before the small group sessions. Then you'll come together in the small groups, Elliot, and in those small groups, you will be working on clinical problems, and that time will be used to answer the questions in the clinical problems that are posed to you. This is done through peer teaching, but also, as I showed you before, facilitated by the faculty members. And so your learning from the night before is really being applied in the situation to figure out how to take care of a patient or to answer a clinical problem. And in doing so, go ahead, Elliot, our small groups tend to have a lot of interaction, a lot of fun, and the faculty members and the students become really close. They become like peers and colleagues rather than just being an anonymous face in a very large medical school class. You're actually a well-known entity in your small group. Next slide. And so, as I mentioned before, and as the fourth point for us, what are we doing? And Elliot, go ahead and click. When we have our group of students here figuring out a problem on the board without the teacher sort of there, this is what doctors have to do. Because when doctors are in practice, they don't have a teacher that they can turn to and say, what's the answer or what's the right way to do it? You have to learn how to find the resources. You have to figure out what resources are good and what resources are not so reliable. And then you yourself learn what you can. You use the knowledge that you've gained as well as the knowledge of your colleagues. And together you come up with the best plan of management for your patient. Elliot, next animation again. And so this is what happens in real life. This is what doctors are doing every day. And this is how people keep up and stay current with the medical literature. That's the way people have to practice in the 21st century. So, and then my last slide just sort of summarizes this for you, Elliot. The key differences in learning with the American Canadian School of Medicine, in my mind, are first, active learning. Secondly, learning in small groups. Thirdly, learning the context from MDs who are really dedicated to your success. Our faculty members are there only to teach you. They're not doing anything else, but are there on the island and are really working to help you succeed. And then finally, I think you're developing lifelong learning skills that are really needed for becoming an excellent physician.